a burn, toxic insults, or a wound, and you observe days later that it was already healed and gone? Have you ever wondered how that happened? That process is called tissue repair. Let's explore how does our tissues respond in repairing damaged skin. What are we waiting for? Let's go! Tissue repair is a natural process in which the primary goal is to restore the structure and function of the tissue following an injury. Tissue repair can occur by regeneration or by fibrosis. In regeneration, the new cells are the same type as those that were destroyed, and normal function is usually restored. In fibrosis or replacement, a new type of tissue develops that eventually causes scar production and the loss of some tissue function. The tissues involved and the severity of the wound determine the type of tissue repair that dominates.
Now that we know about tissue repair, let's now proceed to the step-by-step process of how tissue repair happens. When the skin is injured, our body sets into motion an automatic series of events, often referred to as tissue repair or cascade of healing. The cascade of healing is divided into 4 overlapping phases: hemostasis, inflammatory, proliferative, and maturation. The first phase is hemostasis. It begins at the onset of injury, and the objective is to stop the bleeding. In this phase, the body activates its emergency repair system, the blood clotting system, and forms a dam to block the drainage. During this process, platelets comes into contact with collagen, resulting in activation and agitation. An enzyme called thrombin is at the center, and it initiates the formation of a fibrin mesh, which strengthens the platelet clumps into a stable clot. The second phase is the defensive or inflammatory phase. This phase focuses on destroying bacteria and removing debris, essentially preparing the wound bed for the growth of new tissues. During the phase 2, neutrophils enter the wound to destroy bacteria and remove debris. These cells often reach their peak population between 24 and 48 hours after injury. As the white blood cells leave, specialized cells called macrophages arrive to continue clearing debris. This phase often lasts 4 to 6 days.
Okay, for the continuation of the phases, here is the third phase, the proliferative phase. So once the wound is cleaned out, the wound enters the third phase, or what we call the proliferative phase. So where the focus is to fill and cover the wound. So the proliferative phase features 3 distinct stages. So for the first stage is the filling the wound. The second stage is construction of the wound margins. The third distinct stage is the covering the wound, or what we call the epithelialization. For the last phase, or the maturation phase, and also called the remodeling stage of wound healing, the maturation phase is when collagen is remodeled from type 3 to type 1, and the wound fully closes. So the cells that had been used to repair the wound but which are no longer needed are removed by apoptosis, or the program to cell death. So when collagen is laid down during the proliferative phase, it is disorganized and the wound is thick. So during the maturation phase, collagen is aligned along tension lines and water is reabsorbed, so the collagen fibers can lie closer together and grow cross-link. So cross-linking of collagen reduces scar thickness and also makes the skin area of the wound is stronger. So generally, remodeling begins about 21 days after an injury and can continue for a year or more. So even with cross-linking healed wound, areas continue to be weaker than an injured skin. So generally, only having 80% of the tensile strength of unwounded skin.
Knowing the process of tissue repair, let's now focus on the effects of aging on tissues. The appearance of skin changes as people age, and athletic performance declines after approximately 30 to 35 years. With advanced age, the number of neurons and muscle cells decreases substantially. At the tissue level, age-related changes affect cells and the extracellular matrix produced by them. In general, cell divides more slowly in older than in younger people. The rate of red blood cell synthesis declines in elderly. The consequence of changes in the extracellular matrix are important. Collagen fibers become more irregular in the structure, even though they may increase in number. As a consequence, connective tissues with abundant collagen, such as tendons and ligaments, become less flexible and more fragile. The reduced flexibility and elasticity of connective tissue is responsible for increased wrinkling of the skin, as well as an increased tendency for older people bones to break. Because of changes in collagen and elastic fibers, artery walls become less elastic. Plaques containing collagen fibers, lipids, and calcium deposits form in the walls of the blood vessel, resulting in atherosclerosis. These changes result in decreased blood supply to tissues and increased susceptibility to artery blockage and rupture. However, it is becoming evident that the physical and mental exercise can slow many of the cell losses and functional declines.
Tissue repair is an essential mechanism to maintain the integrity and function of the body and responds to a variety of both acute and chronic injuries and disease states. Did you know that repair tissue or tissue repair is the process that makes organisms resilient to injuries such as trauma, burns, accidental wounds, surgery, allowing survival, restoration of the protective barrier, and organism integrity. So that's all, and I hope you learned something. Goodbye!